It would cost $5 per person to identify and treat cervical cancer in Swaziland, Africa. Hi, my name is Cassandra Rigsby, and I'm a Public Administration Master's student at OU Tulsa, and I'm also a member of Team MobEx. Our team is partnered with a nonprofit organization called the Luke Commission, or TLC, that addresses healthcare in rural Africa in the form of comprehensive mobile hospital units. Over the past 4 months, our team has conducted extensive research and 20 expert interviews with doctors and other health professionals that specialize in rural healthcare, and also with organizations like USAID and country embassies to develop expansion recommendations for TLC. The Luke Commission is currently located in Swaziland, which is a small landlocked country in the southern African region with a population of 1.4 million people. 80% of this country's population are individuals living in rural areas, which is important because TLC seeks to address these individuals specifically. In addition, Swaziland has the highest rate of HIV and AIDS in the world at 26%. The state of health in this country was so dismal, in fact, that the World Health Organization had predicted that the population would be extinct by the year 2040 if intense intervention did not occur. That's where the Luke Commission stepped in. TLC entered Swaziland 9 years ago and has since served over 200,000 patients, and life expectancy during this time has more than doubled, going from 20 years of age to 50 years of age. TLC's model is effective, and our team believes that they could scale impact through internal expansion of services and through external expansion to another country in the region. In terms of service expansion, we identified that cervical health is an area that needs to be addressed in Swaziland. The country currently has the 7th highest rate of cervical cancer in the world and only 1 oncologist to treat its entire population. In keeping with World Health recommendations, we identified a strategy to treat cervical health that would include prevention, intervention, and treatment strategies, beginning with an HPV vaccine and moving to a see and treat system that would include cryotherapy, which treats the early stages of cervical cancer. We've also begun to work with organizations and begun the grant application process to fund the HPV vaccine. For geographic expansion, we identified that the entire Southern African region has a lack of these comprehensive mobile units like TLCs, and 2/3 of all HIV-infected individuals live in this region, with it being largely rural. We identified through analysis of 5 countries in the region by analyzing them based on a metrics of need and ease of entry, including criteria like rates of HIV and AIDS, secondary diseases, corruption, and also potential partners. And we also analyzed potential expansion models that TLC could use. We came to the conclusion that TLC should expand to Botswana, specifically the Central District, in 2 years, utilizing a partnership opportunity with an organization like Population Services International or Management Sciences for Health. They should do this with a 20-person team that would include 1 doctor, 5 nurses, 5 support staff, management, and administrative staff. Utilizing these recommendations, TLC could potentially provide cervical care to 20,000 Swazi women per year and provide HPV vaccines to 10,000 patients per year at the material cost of $1.77 per patient. Outside of Swaziland, TLC could potentially serve 50,000 patients health services, including diagnostics and doctors' evaluations, at 15% of what it would cost in the US. Thank you for your time.